Everyone, welcome to the channel. In today's video, we will talk about emergency contraception. So here we will learn when it should be used, how effective it is, what are the side effects of emergency contraception, and can it be used as a regular contraceptive or not. Emergency contraception is also known as a post-coital contraception or morning after contraception. Emergency contraception refers to the methods which are used to prevent pregnancy after an unprotected or inadequately protected sexual intercourse. It is intended only for the occasional use and it is not a substitute for your regular contraceptive method. So it cannot replace your regular oral contraceptive pills. And second important thing to remember is that it is not a abortifacient, means if a female is already pregnant, it will not cause abortion. It prevents pregnancy before the implantation occurs. What are the conditions where emergency contraception can be used? So it can be utilized in the situation like your sexual or assault or rape. Whenever there is an unprotected intercourse, it should be used. If there is a condom rupture, then it should be used. If a female is already taking regular oral contraceptive pill, but the pills are being missed or there is some delay in the taking OC pills, then also it should be used. The most commonly emergency contraception used is your Levonorgestrel. It is the most commonly used. What is the mechanism of action? It inhibits or delays the ovulation. Second, it prevents the fertilization of an egg by affecting the cervical mucus and the ability of the sperm to bind the egg. In the case of emergency contraception, timing is very important. So it is most effective when it is taken within 72 hours and ideally it should be taken as soon as possible. We should not wait for the 72 hours window, or as the name suggests, morning after contraception, we should not wait for the next morning. The pill should be taken as soon as possible after the unprotected sexual intercourse. Efficacy will depend upon the time and it should be recommended that it is taken within the stipulated time frame and it is 85% effective. It is available under the various government scheme as well, and it is also available as the over-the-counter without a prescription drug. Under the name of Easy Pill, it is available at various government public health facilities. While the unwanted 72, I-Pill, Pill 72, these are your over-the-counter preparations. And they can be purchased without any prescription. So, in the public health facilities, the emergency contraception pills comes under the name of your Easy Pill. It contains a single tablet of 1.5 mg and this is to be taken within the 72 hours after the unprotected sexual intercourse. It is safe for all the women, including those who cannot use the combined hormonal contraceptive methods. What are the side effects? The common side effect includes nausea, abdominal pain and vomiting. Less common side effects include your headache, dizziness, breast tenderness and irregular bleeding. Female takes emergency contraceptive pill and vomiting occurs within 2 hours. Vomiting occurs within 2 hours. Then the female has to take again along with an antiemetic. Means a female has taken a emergency contraception pill and she has vomited after taking the pill within a span of 2 hours. Then first the female will take some antiemetic drug and after half an hour she can take again the emergency contraceptive pill. intrauterine devices can also be used as an emergency contraception. It is the most effective emergency contraception. The earlier we have studied is the most commonly used. It is the most effective emergency contraception. What is the mechanism of action? That the copper IUCD releases copper ion that are toxic to the sperm and ova, that inhibits the fertilization and potentially preventing the implantation. The timing is important. It is to be inserted within the 5 days. What can be the limitations in the case of copper IUCD is that a trained healthcare worker is provided for the insertion, and it may not be suitable for the individuals with certain uterine abnormalities or acute pelvic infections. But the combined oral contraceptive pill can also be used as an emergency contraception, and the regimen is named as a UZP regimen. This is sometimes asked in your MCQ or Viva. In this, high doses of combined oral contraceptive pills are given in 2 doses, which are 12 hours apart, and it is also to be initiated within 72 hours of unprotected intercourse. It is less efficacious and associated with more side effects compared to the other emergency contraception, so it is not commonly recommended unless other options are unavailable. But for examination point of view, you should remember that oral contraceptive pill can also be used as an emergency contraception. So it will depend upon the amount of ethinyl estradiol present in your OC pills. If the amount is 50 microgram, then we have to give 2 tablets, and if the amount is 30 to 35 microgram, then we have to give 4 tablets, and after 12 hours we have to give 2 tablets here again. After 12 hours we have to give 4 tablets again. So if the examiners give you Mala N or Mala D, then it contains 30 to 35 microgram, then we need to give 4 tablets within 72 hours, and after 12 hours we need to give 4 tablets again. So you have to see the composition of the OC pill which is being given to you. If the amount is 50 microgram, then you have to prescribe 2 tablets, and if the amount ranges from 30 to 35 microgram, then we have to give 4 tablets. Then it summarizes the various emergency contraception used. So Levonorgestrel is the most commonly used. Copper IUCDs, these are the most effective. From the examination point of view, you should also remember that mifepristone can also be used as a emergency contraception, and this is your OC pills. Combined oral contraceptive pills can also be used. The timing is important. Copper T is to be inserted within 5 days. The LNG tablets to be taken within 72 hours. If the pill contains 1.5 mg, then a single tablet is to be taken. If the pill contains 0.75, then 1 tablet is to be taken start, and after 12 hours we have to take second tablet.